Hi everyone, I'm Cynthia Peschong with Core Medical for Lumen Technologies. Today I wanted to address some concerns regarding some recent statistics that people within the age group of 25 to approximately 58 are not really following through with their chronic medical conditions. So today we wanted to let us help you connect your mind with your body, because your mind and your body are really connected more than you could ever know. So it's the old saying, if you are feeling anxious, if you are feeling that stress and anxiety, then your cortisol levels go up, and then it affects your blood glucose in ways that are not so great for performance. So we just want to help you connect your mind and your body, and we want to know when you come see me about these things, for the physical side, or you can see our mental health counselors. We have two of them here in Core Medical. We have Katie Lee and we also have Tammy Conrad. Both are available to see you virtually, so it's completely private and confidential. So, and I really want you to put the two things together, put that physical and put that mind together, and then you'll really come out with the best outcomes. But I really do want to encourage people who have those chronic medical issues that you see your providers. It is not something that you want to see somebody once a year for. You should be seen at least every 6 months if you're on chronic medications, by the way. And if you're not having your annual exams, how are you ever going to know? It's like changing the oil in your car. If you just let it go, eventually your car is going to go clunk, 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 and then it's done. And then you just blew your engine. That's exactly what's going to happen to your body if you don't pay attention. When I say, do you know your numbers? The first thing I think of is your BMI. What's your BMI? Your body mass index, okay? That is a calculation between your weight and your height. Guys, you can look this up on Google. They have calculators there. You can find out what your BMI is right now. The good BMI is between 19 and 25. If you're below 19, you are too skinny. You need to put on some weight. If you're closer to the 25, you're still normal, believe it or not. You are not considered overweight until you're over 25. If you're over 30, you're actually considered obese, and you need to really discuss with your provider to how to lose weight options, okay? Or you're going to put yourself at a higher risk for diabetes. Blood pressure. What's your blood pressure running? A good blood pressure for anyone, whether they're on medications or not on medications, is somewhere between 130 and the 80s. So we have work over rest, or systolic over diastolic. So this is your heart and how fast and how hard it is working. So 130s over 80s, that's where we want to see you at all times or better. Okay? Heart rate between 60s and 110s. Okay? I say 60s and 110s because some of you are athletes and you are going to have a naturally lower heart rate, and that's okay. There's nothing wrong with that. I know runners that run in the low 40s. That is very, very normal for them. That is not normal for somebody who is not an elite athlete, by the way. So if you're running in the low 40s and you are not an athlete, that is a giant red flag. But if you're running in the 110s or higher, and you don't have a reason for it, say, I just climbed up a bunch of stairs, I just ran out to my car in the middle of the rain, those would be normal excuses because your heart rate would just return to normal in just a few minutes. But if it is constantly at that 110s, 120s, something's going on. So you probably should have that checked out. Most of us have Apple Watches these days and keep track of that kind of stuff for us. So it's a good idea, guys. If the more you can tell us, the more we can help you. All right. So the next thing, O2 sats, oxygen saturations, 92% on room air. It is a little different here because we live in altitude, and altitude does affect our oxygen saturation. If you're in Florida and you're 92, I'm going to be putting oxygen on you in an emergency room. But here it's considered normal because we are much, much higher in altitude, and our hemoglobins actually compensate to give us more oxygen in our blood. Respiratory rate, 16 to 18, pretty normal. I've seen them go up to 20, 24 when you're huffing and puffing, or somebody who is having an asthma attack or shortness of breath, that kind of good stuff. All right, so let's go over here. Other things that you should have other than your annual wellness exam. So you should have annual labs done. Very important to have these done maybe at least once a year, which your insurance is awesome at paying for. So let them. You need to know your numbers. So your CMP, this is your comprehensive metabolic profile. This one's going to have your fasting blood glucose in it. It's going to have your liver functions. It's going to have your kidney functions. And it's going to tell me what your electrolytes are doing, that you're not dehydrated. Your CBC, your complete blood count. It's going to tell us your red count, your white count, your hemoglobin, your hematocrit, and it's also going to tell me your platelet count. So that's going to show me, do you have an infection? Do you have a bleeding disorder? Do you have a blood clotting disorder? Are you anemic? All kinds of fun stuff come from that one, and it's an easy test to do. It is relatively cheap. TSH, thyroid stimulating hormone. So your thyroid controls so much, from fatigue to hair loss to dry, itchy skin, all kinds of fun stuff with your thyroid. It really controls a lot more than people think it does. Anyways, so it's a good screening to have your thyroid checked. It affects your stress levels. It can make you feel more stressed. It can give you anxiety if it is out of whack. And there's two ways it can be out of whack. It can be either too high or too low. Either way is going to affect you physically. So it's something you should be screened for at least once a year, okay? So lipid profile, total cholesterol. We all know your cholesterol is supposed to be under 200, okay? Almost the whole world could benefit from being on a low-fat, low-cholesterol diet. The other part is your triglycerides. Your triglycerides are the fats in your diet. That's that ice cream. That's that cream in your coffee. A lot of cheese will raise the fatty fried foods. Going to McDonald's, eating French fries, donuts, that kind of stuff will raise those triglycerides. We want good fats, not bad fats. So the other parts are your HDL, which is your good cholesterol, and the other part is your LDL, which is your bad cholesterol. So we want that good cholesterol nice and high to clean out your coronary arteries, and we want that LDL under 100, believe it or not. The new standards are completely different. If you're diabetic, you should actually be under 70. Hemoglobin A1C, that is a test that we use that shows what your blood sugar has been doing over the last 3 months. So if it's elevated, we know your blood sugar has to been elevated over that 100 mark, up and down, up and down, up and down, and then your hemoglobin A1C is going to be higher than 6.5. If you are higher than 5.7, you're considered pre-diabetic. If you're higher than 6.5, you're actually diabetic. You just may be controlled with diet. Or it may be much higher than that, and you actually need medications to control diabetes. So men, other thing we should think about, if you're over 40, I want you to have your PSA done, your prostate-specific antigen, just part of your blood work, same draw up here, not going to stick you twice. It should be under 4 all the time. And then we watch that number every single year. And when it starts rising, or if it ever starts rising, then we know there's a problem, such as an enlarged prostate or prostate cancer. Women over 40, yearly mammograms. Please, ladies, keep your mammograms updated. It is so incredibly important, especially over the age of 40, especially if you have a family history of breast cancer, okay? Nobody likes to say the cancer word, but I'm going to say it for you. Breast cancer. We need to be monitoring this. Very common. It is very easily caught if you're doing your mammograms in early stages so that we can actually keep you alive. So please, please, please have those yearly mammograms done. I know it's not comfortable, but there are worse things in this world, guys. That's for sure. The other thing you need to do, pap smears. If you haven't had a complete hysterectomy, you need to be having a pap smear between 1 and 3 years. 3 years if you're normal, 1 if you're on any kind of hormone replacement or birth control. All right, so immunizations, last things I'm going to talk about. You should have yearly flu shots to keep yourself safe. You should think about your COVID vaccines, especially the new bivalent that's out. You should also have Shingrix, 2 doses. Shingrix is extremely effective for preventing shingles. Anybody over the age of 50, you're a 1 in 3 chance of actually coming down with shingles. Incredibly painful. And if you get it on your face or your scalp, which nobody can predict, it is going to be incredibly painful. And I feel for you. I really do. Anyways, this is how we can prevent that, by getting those people the shingle shot. DTaP every 10 years is tetanus, diphtheria, Adacil, pertussis. Pertussis is whooping cough, guys. We are trying to protect those newborn babies out there by keeping you up to date, and we're trying to keep you from getting tetanus, which everybody seems to think that tetanus doesn't exist anymore, but it actually does. There are those cases in which we see people who are positive for tetanus. So all this stuff we're talking about in your wellness exam. If you can't remember this, that's okay too. Your providers will know. Come and see us here at Core Medical, or go see your provider. That's what I really want you to take away from this message, is that let's not ignore our health. Let's put that mind and body together so that you can live your best life. I'm Cynthia Peschong with Core Medical. Take care. Be well.